Hey, welcome back to Daybreak Live. We're joined this morning by Dr. Rick Redmond and Morgan Ragsdale of Southern Smiles here in Sylacauga. And good morning to both of you.
Good morning.
Good to have you with us. Dr. Redmond, the last time we talked, which has been a little while ago, you were just beginning the IV sedation. That was a year ago this past January. How's that going?
It is going very well. Actually about to send my future partner, Dr. Casey, to get her training because I'm getting too far out with IV sedation.
What is the pluses of IV sedation?
The main thing is if folks either need to have a whole lot of work done, or if, of course, they're very anxious or nervous.
Chicken?
Yes. Then it's with the IV sedation, you can just keep giving them a little bit till you get them to where you want to be.
Yeah.
The gas works, laughing gas, but it's not nearly as effective. On a few people it is, but with the IV sedation, you just keep giving them enough till they're relaxed.
The mini implants, I'd really not heard of mini implants a whole lot until we began talking about it over a year ago.
Yes, and those do very well. Morgan she can probably tell you more about the
Morgan's the treatment coordinator.
Yes.
Morgan, I know y'all are busy.
Oh, we are. The mini implants, they're just less invasive. So in today's busy world, it makes it a lot easier for the patients. The healing's faster and there's just a lot less downtime. And with sedation, we have so many fearful patients. Being fearful of the dentist is pretty common these days. So giving them an out, giving them a way to have the dentistry that they need, but in a more relaxed state, it really helps.
And Dr. Redmond, there's a lot of history to people's fears of dentistry, especially from years ago.
Oh, yes. Going, I'd say, back to the cowboy days.
So IV sedation, who qualifies for this?
That is something the state makes it very difficult in my mind. It's definitely a process. They have to come, inspect your office, make sure you have all the equipment and the emergency drugs that you need. Then you get a temporary license, and then after you've been doing it for a few months, they're going to come watch you do a couple sedations, and then you have to do an oral exam and on all the emergencies in front of a couple oral surgeons. So they make sure you know your stuff.
Morgan, you were telling me that you started, I think, 2 years ago, and you had 80 employees that time. You've doubled. So, Dr. Redmond, y'all are growing, right?
We are. We've been very blessed. There's no doubt about that.
You're growing both numerically and physically with your facility.
Yes. I would have never imagined 4 years ago when we moved into the new office that I'd need more space already. It is crazy.
And that's a good problem to have.
It is.
Yeah. So, Morgan, what are prospective patients looking for when they come to Southern Smiles?
Well, I think overall, just a good family atmosphere and a non-fearful way to have dental work done. I know that myself included, nobody enjoys going to the dentist, but we work really hard to make it a comfortable place to be, as well as just, making sure that you don't feel judged. So with all of our patients, we make sure that they have the care that they need and want.
Yeah, Dr. Redmond, I kind of break out in a sweat just having you guys on the set, but you kind of try to make it personable for the people, right?
We do, because we know, I tell the ladies all the time, you have to remember, nobody likes coming. I mean, when we get there in the morning, nobody's beating down the door to get in. So it's just, we really work hard on that, having that, like Morgan said, that family, relaxed atmosphere.
So mini implants. For people who do not know more extensively, tell us about that.
Well, a lot of times there are, there's traditional implants, and it just takes a more, like Morgan said, a more invasive procedure, and then you need more bone for those. Now, I do tell folks don't get hung up in the size of them, because 3.0 and larger is considered traditional, and the sizes I place is 2.5 and larger. So, if I'm using the smallest I use, 0.5 millimeter is not really much different. It's the technique, like Morgan said, where these are more like a self-tapping screw.
Who are you treating?
We treat patients who are missing 1 or 2 teeth. You know, I had a couple people yesterday that came in that had split just a single tooth, and it's much more effective to take out a single tooth if they have enough bone and place an implant instead of doing the old bridge where you got to grind down the teeth on either side of the missing one. We'll also do folks who have dentures, and especially on the lower denture, they can't wear it, and so we'll put in the implant so it actually snaps and holds down into place. And that makes a world of difference. I've had a couple patients that, you know, I'd ask them how they were doing a few months later, and they say, I'm doing well, and then they'll pause for a second, and they'll say, well, I've gained 10 pounds. And I was like, you just told me more than anything else that you can tell me. I know you're eating then.
Oh, wow, no doubt about it.
Yes.
Morgan, you know, a lot of people had kind of given up hope that they could ever smile again.
That is true. So what we like to do, we offer no-cost consultations for implants. We bring the patients in, show them their options, give them a CT scan to be sure that they are a good candidate for implants, and we go over different options as far as getting their smile back.
Yeah, and Dr. Redmond, from a baseball in the teeth, or someone who is older in years that hadn't smiled in a long time, they need to see you guys.
That's right.
We'd love to see them and help them. Yeah. That is for sure.
Southern Smiles, you're in Silicon, what, 4 years now you've been in this new office?
4 years in the new office, and this summer I'll have been in Silicaca for 30 years.
Yeah, you ought to have it right by now.
I should. That's what I've been practicing.
Oh, mini implants. I've seen so much about this in just the last year. And is there any changes in the industry, or is there any thing, or is it basically the same as it was?
They're always learning, you know, through studies what works better. And one of the things they've learned is that the more bone you leave around an implant, I know I'm getting technical, so, you know, it used to be they'd tell you to put a large implant in there, and now they're learning through studies you want not so big, so you have more healthy bone around the implant.
We're talking with Dr. Rick Redmond and also Morgan Ragsdale of Southern Smiles here in Silicaga. And I know I touched on this the last time y'all were here. And as far as insurance is concerned, or cost for implants, mini implants is concerned, can you touch on that this morning?
Morgan's the expert on that, that's for certain.
You just pass it to her.
I do, even in the office.
We do file dental insurance every day. We have an insurance coordinator that works with that, and we also have 7 companies we work with for financing to get your smile back.
Wow, that's fantastic. That gives a lot of people hope, right?
That's right.
It does.
Yeah,
It really
and
does.
the IV sedation, you just don't. Somebody just doesn't walk in and get IV sedation. It's a process, isn't it?
It is. We've got to have a very detailed medical history from them, and then if they have, you know, any medical complications at all, then we get hold of their physician, and usually we'll fax them, and that works better than calling them.
Yeah.
They'll fill out the form and let us know if there's anything we need to be careful of.
I know you've done very well with the mini implants and IV sedation. It just takes a lot of pressure and guesswork off the patient's shoulder. You know, a lot of times we really don't know what to do, so we come to people like you.
Yes, well, thank you. Yes. I think one thing too that Morgan can attest to is technology that we have. It really just helps to show patients what we're seeing, whether it's the CT or, you know, we've got cameras that we can take pictures of the teeth and actually show them, you know, show them what we're seeing up on the television screen.
Yeah. Morgan, how can people make an appointment to see you guys?
You can reach out to us through our phone number. We also, you know, have email through our website, southernsmilesofsilicaga.com. And we also have Facebook, Instagram. You know, we're
you're out there everywhere, right?
We are.
Yeah. Finally, Dr. Redmond, I always ask you this. Tell us a good news story, a feel-good story, without a name of a patient, but someone that you've been able to help.
Well, I had a patient I just finished up this past week who had a partial you know, on her, that she just had her upper front teeth, and she hated that thing and had been dealing with that for years. Back before I started doing implants, she thought about it, and on the traditional ones, I had to send her to oral surgeon. She was going to have a sinus lift, and she'd kind of given up hope about it. And with the implants I'm doing now, the minis, I was able to put in those implants and put, you know, bridges, porcelain bridges back there, and she was able to get rid of her partial, and she was
So
just tickled
if
pink.
people, Morgan, have their teeth, you know, and they want to go to mini implants, maybe they got some teeth and some missing, is this a pretty easy process for them?
It can be. So we offer, like I said, the no-cost consultations, and we'll gladly look at what you've got going on and come up with a good treatment plan for you. And we try to provide options for all patients so that it's not just one and done. We try to give them options so that they can kind of pick what's best for them.
And Dr. Redmond, you're upfront with people. You don't give them pie in the sky stuff because you know, it's embarrassing for a lot of people with the dental hardware in their mouth and stuff like that, and they hadn't been able to smile and they're self-conscious about it.
Look, I tell Morgan's with me all the time when I'm in there talking to the patients, and I tell them I'm going to be upfront with you because I don't want you to be surprised when we finish, and I certainly don't want them unhappy. So I try to put it all out there so they know ahead of time, so neither one of us are, like I said, surprised coming.
So we're getting started with the enlargement of our facility. The mini implants are going great guns, and the IV sedation is the thing. So you guys need to make an appointment, and you know, in today's society, you've got all these options out here.
Yes.
But it's something about dealing with local people that you feel comfortable with.
That's right.
We're Dr. Casey and I are both proud of the fact that there's only one other dentist who lives and works and plays here in Sylacauga besides us two.
Yeah.
So, I mean, this is our home.
Yeah. Morgan, thanks so much for coming today.
Thank you, sir.
And Dr. Redmond, always a pleasure to see you.
Thank
Southern
you.
Smiles of Sylacauga. Again, how can they contact you?
By phone, 256-245-3645. We're also on Facebook, Instagram, or you can reach out to our website, southernsmilesofsylacauga.com.
All right, let's smile again. Southern Smiles of Sylacauga. Dr. Rick Redmond and Morgan Ragsdale with us this morning. We got more coming up after this.